So good afternoon again, Philly. Once again, a big thank you to our host, UPENN's School of Medicine, my friend and colleague, Peterson Wagner, and his team, who are all brilliant, dynamic, young future leaders in this space. They have all done an outstanding job compiling these world-class leaders, advocates in psychedelics, oh, advocates for psychedelics and cannabis. It's an honor to be here among researchers, clinicians, policymakers, and innovators, all united by one mission to improve lives through safe, effective, and accessible care. Today's panel, Scaling Access to Alternative Therapeutics Through Group Health Plans, explores a practical, scalable model for integrating medical cannabis, ketamine-assisted therapy, and other emerging psychedelic treatments into mainstream healthcare, starting with employer-sponsored benefits. Why this matters now. Healthcare costs in the U.S. are projected to exceed $17,000 per employee by 2026. Meanwhile, workers taking mental health leave have increased by over 300% since 2019. Our veterans, first responders, and frontline healthcare workers, for the people who hold our communities together, are struggling with PTSD, depression, pain, and addiction. The opioid crisis remains a national emergency. We are past the point of debate. It's time for action. So what's some evidence and recent relevant movements for compounds like ketamine, Spravato, psilocybin, ibogaine, medical cannabis? Ketamine and esketamine, Spravato, have proven efficacy for treatment-resistant depression. More than 100,000 patients have been treated with Spravato, with over 1.4 million supervised sessions showing a strong safety record under FDA REMS guidelines. J&J reported third quarter Spravato earnings closing in on $2 billion. And we all know probably of Dr. Bronner's Magic Soap study, Dr. Bronner's Magic Soap study, where the employer brought on ketamine-assisted therapy as an employee health benefit onto their health plan, and the results were spectacular. 86% improvement in PTSD, 67% improvement in MDD, and 65% improvement in GAD. 82% reported that no longer were taking antidepressants after 1 year. And psilocybin is in over 100 phase 2 trials and several phase 3 studies for depression, anxiety, addiction, and more. Compass Pathways just hit their primary endpoint in phase 3 with Comp 360 for treatment-resistant depression. USONA Institute launched its phase 3 trial in March 2024 with psilocybin for major depressive disorder. Ibogaine is supported by legislation in Texas. SB 2308 is now allocating $100 million towards research. Ibogaine shows profound promise for addiction and traumatic brain injury. What about the FDA botanical pathway? There is an FDA approval process known as the Botanical Drug Development Pathway, and to date, 4 botanicals have been FDA approved. Abivax, recently acquired the lead pipeline asset brestisilicin for major depressive disorder from Gilgamesh Pharmaceuticals for $1.2 billion, a huge milestone forward for psychedelics in the pharma space. So it looks to me like pharma is keen on compounds that are obviously safe, efficacious, short-acting, have strong IP, and are scalable. These are not fringe experiments or insignificant milestones. These are real-world data-driven therapies and impactful events with bipartisan support, scientific legitimacy, and expanding regulatory pathways, which all bring major attention to the forefront for these potentially life-saving curative compounds, which in turn moves the needle forward for the industry in general. What sort of models are already out there utilizing these compounds, and what models are being introduced? Models and roadmaps are currently being explored and are already in place, such as psilocybin service centers in Oregon and healing centers that offer psychedelic assisted therapy in Colorado. At the local level in New Jersey, there has already been put in place a real-world model for medical cannabis benefits. The Canna Coverage and Future Entheogenic Medicines model, which ties it all together to offer medical cannabis and other alternative treatment modalities as an employee health benefit. We've partnered with vendors like Benebix, Anthea, and Leafwell to build a unique model and roadmap for expanding access safely and responsibly, starting through employer health plans before full insurance coverage becomes standard in the US. This is not theory. This model is already being implemented. We made history in New Jersey and first in the country by bringing medical cannabis as a medical benefit to 3 municipalities. Trenton, New Jersey. Thank you. and two board of eds in Teaneck and Orange, New Jersey. Public sector employees in those three municipalities now have access to medical cannabis as a covered benefit. History made. Thank you. So what's the vision here? We envision counties, states, and eventually the federal government supporting access through employer and public sector health plans, Medicaid and Medicare coverage for psychedelic assisted therapy, and opioid settlement funds redirected towards research, education, and treatment. What's the broader picture? This is not just about medicine. It's about public health, cost savings, and compassion. It's about creating new jobs in behavioral health, supporting innovation in biomanufacturing, synthetic biology, and using data and research to drive equitable access. So today, let's explore how, not if, we can scale all of these alternative therapeutics responsibly through more research and especially through group health plans. Let's ask the hard questions about safety, reimbursement, and regulation. Let's talk about evidence, real-world data, and public trust. Because the people we serve, our veterans, our first responders, our teachers, our employers, or healthcare workers deserve options that heal, not just manage symptoms. And together, through collaboration between insurers, providers, researchers, and policymakers, we can make that happen. Thank you again, and let's begin our panel. Let's start with introductions. Nichelle. Where's my Nichelle? Hey, Nichelle Santos from Canna Coverage. Nichelle, please take a minute and introduce yourself and tell us a little bit about you and what you do in this space.
Thank you so much, Gaetano. Thank you, Peterson. Thank you, UPenn, for having this fantastic event today, Philadelic. I am Nichelle Santos, founder and CEO of Canna Coverage Insurance Services. We provide all the property and casualty insurance services for the cannabis, psychedelics, psilocybin industries, as well as provide health benefits for the workforce of cannabis, as well as to the public sector, private sector. So through this journey, we created that intersection of medical cannabis and insurance services. And then my buddy Gaetano, he said, you know, cannabis is still very complicated because of it's still federally illegal. And there's something called ketamine that already has FDA approval. And you need to take a look at the psychedelics market. And I blew him off for a long time. But the evidence is really overwhelming. And our goal is to bring alternative benefits to increase patient access to alternative therapeutics to improve health outcomes and affordability. It should not just be available to those who have. It should be available to everyone. So we're here to democratize alternative benefits to make the world a better place.
Thank you, Nichelle. Sherry Race. Is Sherry here? Sherry? Come on up, Sherry. Introduce yourself, please.
Thank you, Guy, and hi, everyone. So nice to be here and so lucky to sit beside Nichelle. I am Sherry Race. I am the CEO and co-founder of a company called Enthea. And Enthea is all about bringing access to innovative mental health treatments through employer and union-sponsored plans. The vision was if a McDonald's or a Walmart employee had access to these treatments, we would not only be able to save lives and help people heal, but in doing that, we would destigmatize a lot of these treatments and create demand. People would start asking for access to these benefits and eventually demanding access to these benefits. So that was the vision. I'm very excited and proud to say that now, after 5 years of chipping away at this, we were at 3,000 covered lives last year, and we're now at 300,000 covered lives. Thank you. Most of that applause goes to Jessica, who's sitting in the back, who's local to Philly and who has helped really grow our customer base and helped me realize how important unions were to this puzzle. I got into the space after almost a decade working abroad, or just over a decade working abroad, and had no idea how much mental health was affecting people at home. And specifically in blue collar industries, just taking construction as an example, 25% of all opioid deaths in America are from construction. And most of our blue collar workers who help build our cities have suicide rates at 4 to 5 times the national average. So a really important piece of the puzzle that goes overlooked, and excited to talk about how to bring them access.
Thank you, Sherry. And Reka and Courtney, please come up and introduce yourselves.
Hi, everyone. First of all, thank you so much for organizing, and all the speakers who were before me. I really, really learned so much, and I've been soaking it all in, so thank you. My name is Reka Phillip. I am Chief of Staff at Journey Clinical. At Journey Clinical, we empower licensed psychotherapists like Courtney to integrate ketamine-assisted psychotherapy into their practice, starting with ketamine, but psychedelics eventually. The way we do it is we provide all the education, the clinical protocol, the training, thriving therapists, peer community, and importantly, medical support. And prescribers. So essentially, we cover all the medical aspects of care, like outcomes monitoring, safety, prescriptions, and therapists can stay within the scope of their practice. We also connect patients looking for this care to therapists that are trained in our protocol. And one of the biggest barriers to care is cost, as we all know it. And we are trying to make it as accessible as possible where we can. So right now, we have insurance coverage for our medical appointments for across 16 states, with 11 insurance companies. And we are also partnered with Enthea, who covers all of it, the medication, the monitoring, which is not covered by mainstream insurance companies. So very proud to be partnered with Enthea. And we are also partnered with Compass Pathways that people have brought up earlier, and Cybin. Their psilocybin molecules will get FDA approved end of 2026, early 2027, and we will be the care delivery mechanism for this to go out into the public through our therapists. Yeah. And I think that covers it. We are providing basically the infrastructure and the partnerships to get this care to patients.
Thank you, Reka. Courtney.
Hello? Yeah, okay. Hi, I'm Courtney Gable. I am a licensed professional counselor. I feel really honored to be here and be on this panel with all of you awesome people. And I am here to offer, the therapist perspective in this conversation. I am a trauma-focused therapist. I'm based here in Pennsylvania, although I'm licensed in 5 different states. As a trauma-focused therapist, I seek to have as many tools in my toolbox as possible, and ketamine-assisted therapy has been a really, really beautiful tool to have access to. I am hopefully optimistic for some of these other molecules as soon as possible. I'm also a somatically based therapist, and so the idea of being able to incorporate not only the top down, the mind, brain down into the body, but the body up, the lived experience, the felt experience is such an important part of this, and I am using the ketamine in the process as much as possible.
Great, thank you. Okay, that's fantastic. I'm your host, Gaetano Lardiri. My background is 40 plus years in the medical field, 25 years in oncology research. In the last 15 years, I've been an advocate and a consultant in the cannabis and psychedelic space. So let's start with our panel. Nichelle, the comeback of cannabis is real. What does it mean for the future of healthcare, and how do you see it fitting safely into employer-sponsored health plans? How will alternative therapeutics like medical cannabis, ketamine-assisted therapy, and even psilocybin changing the landscape of behavioral health and chronic pain management?
Great question. And the comeback of cannabis is very real. Cannabis has been used as a medicine since the beginning of time. God put it on this planet for us to use in so many applications. Currently, we know that it's applicable for over 70 medical conditions and illnesses. That's just cannabis. But America has a problem. We have a problem with chronic illness. We have a problem with mental health. 20% of the population suffers from some form of mental behavioral health. We have an issue with chronic back pain or chronic pain. And 50 million people suffer from chronic pain. And then we have all the chronic illnesses. So that's well over half of the population has some type of medical condition that can be impacted by these alternative benefits. And it is high time that they become available through employee health benefits. That's the way we can scale access. So like you mentioned, Gaetano, the city of Trenton, we implemented medical cannabis just in January of 2025 this year. So it's still a little early to describe the patient outcomes and reveal that data, but we're excited to take a look at that because that's where, in the public sector, is where we can impact teachers, firemen, fire personnel, and law enforcement that deal with trauma, some on a daily basis, weekly, monthly. They are greatly impacted, and these are the folks that protect and serve, teach our children, and they're dealing with trauma very often. They bring that home to their families. They don't know how to reconcile all that trauma that piles. So giving them that alternative to these therapeutics can increase the viability of our community. It reduces trauma. It improves those health outcomes, and they can deal with the children, whether in school or at home. This can help to lower the divorce rate that's so high in this country. It's so high amongst teachers and police and fire personnel. And so making it available as that employee health benefit where 50% of the population gets their private health insurance can have a great social impact on this country.
Thank you, Nichelle. Nichelle, employers are facing double-digit increases in healthcare costs. How can alternative benefits help lower costs while improving employee well-being and productivity? What are some of the evidence-based ROIs, indicators, or measurable outcomes that demonstrate the value of these therapies for employers and payers?
Another great question. When we look at the prescriptions that cannabis can replace, ketamine-assisted therapy can replace, and then psilocybins, and we look forward to the day when ibogaine is available. It reduces the cost of the employer group's prescription plan. It greatly reduces it. It reduces the number of emergency room visits and relapses. So it has a profound impact on the healthcare spend. When we just look at one case that we very often use of a patient who has relapsing multiple sclerosis. She was prescribed the traditional prescription Copaxone, which at the time was over $7,000 a month to that health plan. She took a look at the adverse effects and decided, I'm not going that route. I don't want to monitor my heart, liver, kidneys, and then be given another cocktail of prescriptions that would just lead to the downward spiral of her health. She instead chose a regimen of cannabis, and at that time was about $1,000 a month. So she was saving the plan just $6,000 a month right there. And then you add in all the lab tests and additional prescriptions. So she ended up saving the health plan over $1 million. And when you extrapolate that into thousands of employees, it's millions of dollars that we're talking about in saving. And if it's a public sector client or employer group, that's taxpayer dollars that we're saving. So it has a tremendous ripple effect.
Thank you, Nichelle. And you answered my third question, actually. Did you have something to
Could
add,
I
Sherry?
add something to that? Just to what Nichelle said, which is really beautifully put. The Milliman organization did a report. You can Google Milliman behavioral health or something, and you'll see this report they produced that looked at 21 million insured individuals, so a very large sample size. And they saw that 10% of high cost plan members are responsible for 70% of healthcare costs. So 10% of people are responsible for 70% of healthcare costs. Of those 10% of people, 60% of them had a behavioral health diagnosis. And what we've seen analyzing claims data, to your point, Nichelle, is that these people that have a behavioral health diagnosis are usually spending 21 times more than your average person in terms of their healthcare spend. What we've also seen from analyzing claims data and other reports that are out there is when someone has an underlying behavioral health issue, for example, if they have depression and diabetes or depression and a heart condition, that underlying behavioral health issue is causing a much higher cost of treating the diabetes or treating the heart condition. So if you have depression, treating your diabetes might be 4 times more expensive than treating your diabetes if you didn't have depression, which is why for plans, treating the underlying behavioral health condition can save employers a lot of money. There was another study, and then I'm almost done, I'm sorry, by Health Canal that showed untreated mental health is costing US employers $3.7 trillion a year, trillion, not billion. And then finally, I'll say in terms of the costs and what employers can save, we talked earlier today about Spravato. There was a great presentation on Spravato and generic ketamine. Well, employers are covering Spravato right now through their health offering, through their health plan. And if they are a self-funded employer, which means they're taking on the risk, they're spending about $40,000 to $45,000 a year on that person's Spravato. And this protocol does not include psychotherapy, like we learned in the earlier session. It's coming in for the nasal spray, which yes, is beneficial, but combining generic ketamine with therapy is shown to be clinically more effective and a fraction of the cost. So it's about $6,000 versus $40,000, which is a huge savings to the employer if you switch people.
Thank you for that, Sherry. So, Sherry, let's stick with you. So, how do Canna Coverage and Enthea work together to expand access to innovative health benefits, combining medical cannabis and psychedelic assisted therapies, so employers can offer holistic options for employees living with chronic pain, depression, and PTSD?
Yeah, so I'm really excited to be sitting between 2 organizations Enthea has partnered with. And we are working with Canna Coverage to spread information and spread awareness. Canna Coverage has a great book of business and does a great job, even at presentations like this, in terms of educating customers on how much they're spending and how much ROI they could see if they were to adopt ketamine-assisted therapy as part of their health offering, if they were to adopt, in some areas, psilocybin as part of their health offering. So it's a partnership we're quite excited about. And what we've seen is this is the missing link. Employers now have sort of heard, maybe they watched 9 Perfect Strangers or How to Change Your Mind. Like they've sort of heard about the benefits of ketamine or psychedelics somewhere, but they're not making the connection of, oh, this will save my company money. Like we will have a workforce that's more engaged, more productive, less absent, we'll have less issues of retention, and we'll be able to save on claims costs. And that's where a partnership with Canna Coverage comes into play because of the important need of educating employers.
Right. And Sherry, what outcomes should employers be tracking to evaluate the impact of both psychedelic assisted therapy and cannabis from mental health outcomes to workplace productivity and healthcare cost savings?
Yeah, so there are different outcomes that can be tracked. If an employer is self-funded, which for people who don't know that term, about 75% of companies in the US are self-funded, which means they are actually paying for the healthcare of their employees. They might use a Kaiser or a United or a Blue Cross Blue Shield, but they're using that as the middleman. They're the ones fronting the bill. So for those 75% of employers that are self-funded, tracking the claims cost is probably the biggest outcome in terms of ROI. If they're seeing that before in implementing cannabis or ketamine-assisted therapy, their claims were X amount of dollars a year or per employee, and post implementing those treatments, claims cost goes down. That's like their number one ROI. Unfortunately, the one that they track the most. Then you can track like by partnering with Journey Clinical, when we have providers that collect good patient outcome data, we can report to the employers whether or not there was a reduction in PTSD symptoms, a reduction in depression symptoms, a reduction in anxiety symptoms. So we can report those outcomes even anonymized so that they have an idea that the people that are getting treated are getting better. Other data that HR departments can track is absenteeism. So people often won't say, I'm calling in because of mental health issues. But even if they're calling in sick or whatever the reason they give is, the number one reason is usually a mental health issue. 60% of the time we call in sick, it's actually due to mental health. So employers can track, did absenteeism improve? And also, did retention improve? Are we having less churn of employees? And then finally, there is one more thing that they can track. I'm forgetting. Especially with the union population, they can track suicides. And an unfortunate thing to track, but when you have such a high amount of suicides per year, it is important to track, and they are already tracking how many people they lost a year, and the idea that it would go down.
Excellent. And Sherry, one last question for you. What practical steps do employers need to take to successfully roll out innovative benefits like these? And how can Canna Coverage and Anthea support them navigating compliance, communication, and adoption?
Great question. So what important steps can employers take? I guess one, being open-minded. It's been interesting, this journey with Anthea, and I don't want to name big company names, but we started our journey talking to a lot of Fortune 500 companies, large employers, a lot of Silicon Valley tech companies, and they were so focused on the ROI from a financial perspective and didn't seem to care. I'm painting a broad stroke, but didn't seem to care enough about their employees' well-being that they were not open to this conversation. Like, I had one very large company say, oh, well, employees will get better. Well, our employees only stay here on average 2 years. So that's not really helping. And I was like, oh, okay. So one, employers could maybe care about their employees' well-being. That would be a good start. And then two, I think, it's just trying to let go of some of the stigma and some of the biases. Another very typical experience Jessica and I have when talking to employers is we bring up, so we stopped using the word psychedelic when talking to employers. We started as a psychedelic company. All of our branding was psychedelic. I don't even say ketamine anymore. We say innovative mental health benefits. Like, that's the language we have to use to get into the door. But eventually, we're not lying to the employers. We do have to use the word ketamine eventually. And when we do, so often people are like, oh, I had this experience in college, or do you mean Matthew Perry, or do you mean horse tranquilizer? And it's like, we can address all of those concerns, but if employers could come to the conversation just a little bit more open to looking at the data instead of thinking about all these stigmas that come to mind. And then I think, well, those are being open-minded, I would say.
Great. Thank you. Thank you, Sherry. Let's move on to Rekha. Rekha, what are the biggest barriers you've seen in getting alternative therapeutics like psychedelic assisted therapy covered under group health plans, and how can we overcome them?
Yeah, I think the biggest barrier is education, actually. So just even big employers and patients and people are not really aware of how effective these medicines are if done safely in a therapeutic alliance. So I think the way to overcome that barrier is just through data, through outcomes data, through sharing those. I think everyone here is responsible once you leave this room to share that. And I think sharing human stories is important. So not just data, but even personal stories is important to get that out there. The other way is, or the other barrier is, I think just structurally, insurance companies, they don't have a mechanism to cover the whole aspect that Enthea does, but just larger insurance companies. They cover the medical aspects, but we use sublingual ketamine because it's FDA approved only for as an anesthetic. It's not FDA approved for depression or mental health right now. The medicine is not covered, and the dosing session with the therapist, which is a few hours long, is not covered. So that still adds up after a few sessions, that adds up in cost. And so if insurance companies can realize the benefit, and just like Enthea has and Canada Coverage has, and bring in codes, new codes for this with psilocybin coming up, other FDA-regulated drugs coming, that will get FDA approved. I hope that that will be the case, and new codes will be out there to reimburse providers for coverage. And then just even regardless of psychedelics, I'm deep into this insurance world, and reimbursement for therapy by mainstream insurers is not great. And Thea, I know, has really good reimbursement rates, actually. But this also disincentivizes therapists to provide insurance. And so, because their cash pay rates are higher. And so I think if there's more fair reimbursement, this will break that barrier.
Great. And Rekha, how can organizations like Journey Clinical help build the infrastructure needed for insurers and employers to safely offer psychedelic therapies as a covered benefit?
So at Journey Clinical, we are providing all that infrastructure, actually. We are basically the bridge between insurance companies and drug developers, like who we're partnered with, like Compass Pathways, who are bringing the drugs to market, and therapists who are on the ground at the forefront of care. So, we're essentially bridging policy and practice. And so that's how, we can get this care. We have over 2,500 therapists in our network currently, and there's 1.4 million therapists in the US. So it's a small chunk, but it's still large. We're currently at 25 states and hope to grow. There's 60 million patients with treatment-resistant depression or mental health condition. So there's lots more work to do. And so we hope to build that infrastructure to get that treatment out into the real world.
Great.
Let me just say, this is
Sure.
still a nascent market. These alternative therapeutics is brand new to millions of people out there. So the fact that we're here having this conversation is really historic. So there's a lot to be done in the evolution of reimbursement with the insurers, insurance companies, because like Sherry said, most of these groups are self-insured, which means they have autonomy in what they want to offer to their employees. So they can decide, it's up to the broker to negotiate and all of us what the employer will cover, whether it's 100% of the ketamine treatment, it's a 80-20 split, or they want their employee to have skin in the game and make it a 50-50 split. So there's lots to be done in this space, and I think we're on the right path.
I mean, if in the ideal world, Medicare and Medicaid would cover this, and that would legitimize this treatment and bring that coverage to many, many more people.
And Rekha, based on your experience, what does a practical roadmap look like for integrating psychedelics? Yeah, that's for you.
I think right now we're already doing it. We're already integrating psychedelics through our member network. So you mentioned Spravato. So we're actually piloting Spravato in our therapist offices, which is never done before. They're usually done in clinics. And in that way, they're doing it in a very decentralized network with our medical providers coming on site. And because this therapy is fully insurance covered, I think, that's the current roadmap. And then bringing Anthea to many more employers, bringing Canna coverage to many more employers. I think that's the now. And then when Compass Pathways and Cybin, there's so many drugs in phase 3 trials right now. When they become FDA approved, that will be the next stage of getting this medicine out there. And then eventually, I think like widespread adoption, mainstream adoption, and we don't call this alternative or innovative anymore, where this can become just healthcare. I think I hope the eventual roadmap. I think Dr. Rasmussen said earlier, this should not be a privilege, it should be a right. And hopefully companies like us really build that roadmap towards that.
Thank you, Rika. We have.
Can I just say, this is a call to action right now. All of you are either employers or an employee, and we can create this opportunity. Employees can demand for this to be available in the health plan. The employers are looking for ways to save money, and they don't know about this. So it's up to all of us. You know, it's great we're here today, but having a call to action to make this a real action plan to implement into healthcare. Please come see us when the session is over.
I know Guy's going to kill us because of time.
We have about 2 minutes left, so let's get to our practitioner on the panel. Courtney, Courtney, what are your thoughts about the current training available?
And we only have 2 minutes.
What'd she say? Yeah.
I think, well, I think that there are a couple things that I kind of want to just put an asterisk on before I answer that question. Is that there are two different sort of paths that I see diverging here. And one is the incredible acrobatics that all of you are doing to try to make this work within a very, very complicated and imperfect system. I think that the idea of being able to create this from the ground up would look very, very different. And so the idea of what is possible based on what we have now versus what is possible based on if policies are different, if policies, can be changed and those conversations can happen. It'll be interesting to see maybe next year, what the panel conversation is or the year after that. As far as training, I think that there are some really wonderful training options out there, but I forgot who it was who mentioned before, it is still a little bit like the Wild West. We do not have a centralized governing organization for this, and that is challenging. And so I think that there are a lot of people who are putting up shingles for having done a couple of hours of a workshop that they're ready to go, and I would like to see much more training be done. But if people want to talk about trainings and recommendations, you can come see me afterwards.
Great. And Pete Peterson is going to bring out the hook for me, but one more question for Courtney. What do you see as a primary obstacle for care?
I think that one of the challenges that we have is that we have a trauma-inducing culture. And it is really hard to treat an individual when they are in a system that continually harms. And so that acknowledgement is really important. I see that as our primary.
Thank you. There's our panel.